How did that feel, you guys?
I thought it was good. I think they worked well together.
Yeah, we missed a few things, but I think there was good group interaction. I think overall we did all right.
It felt so real. I really, my heart rate was right up there.
Yeah?
Yeah.
Well, that's good. That's good. How were your thoughts, Andrew?
I felt like we really were covering for each other, and we were using pretty good closed loop communication and dealing with the airway and getting the meds administered to the patient. I think it went fairly well.
Yeah.
Yeah,
What Seth, you said that you missed some things. Tell me, what do you think you missed?
Well, I think we could have done a better job on exam. I think there was sort of this lack of resources, and we had to prioritize what we needed. But we really didn't get a secondary done the way we needed to, and a fast exam would have been good. But I think we prioritized what we needed first, which was good. And everybody had a role, and I think everybody knew where they needed to be.
Do you agree with that, Steve? I heard
Yeah, I do, especially, the lack of resources. So, Seth was the team leader, and he, started to delegate responsibilities, and everybody went and took care of what he had delegated.
Yeah.
We could have used a few more people in the room, I think.
Well, I think this is getting to something that I observed and I wanted to talk to you about. I think there's some things that you as a team did well, and you've identified them. There's closed loop, and you guys just seem to be very fluid in how you took care of what needed to be done. But there was a moment that I wanted to share with you that I observed that I have concern about. And it was, Seth was the natural team leader. You guys all knew that he was in that role. He was standing at the foot of the bed, much like we had talked about in our CRM talk before these scenarios. But when the decision was made to go put the chest tube in, I think that decision was just made and it was assumed by the room, and then Seth moved to go do it. In the moment that he moved to go put that chest tube in, I think he stopped being the team leader. And I'm concerned because, one, there wasn't a conversation about it or an understanding, and two, then that your team lost leadership. And I was just curious, Seth, what were you thinking?
I guess my thought process was I saw everybody occupied doing the task. I knew the airway was going to take some time in terms of we had to push meds. Steve had to actually secure and get the patient intubated. And I think everybody was involved in either maintaining vital signs, just so everybody was in that mode. And then when it came down to it, the chest tube just needed to be placed. We called radiology. They were on their way to take some images, so we needed that tube placed before they actually got there. So my thought process was just getting the procedure done as quickly as possible.
Did you have any hesitation?
I guess the only thing I was concerned about was being able to monitor the patient and monitor the situation while multitasking and getting prepped for it. So I think at different points I would call out for vitals and watching the patient, but I wasn't as focused as I think it could have been on what was going on.
And I think that's it, as we get, we run the risk of error fixation, right? So, or fixation error, I apologize, where you get focused on what you're doing, the task at hand, and then you kind of lose sight of the other information. Did anyone else have any kind of concern about this, or was this just a team performing really well?
I noticed that when Seth stepped away from being the team leader, and I remembered what we said, or what you told us in CRM discussion, but, Steve was really busy with the difficult airway management, and Andrew was really busy with lines and so forth and giving the meds, and so I didn't say anything because it seemed like the only thing that could be done.
There wasn't any other alternative? What could have been another alternative to what happened, where we could have maintained the team leader?
Well, he could have passed the role off to me while we were working, while he was putting in the chest tube.
Would you have felt comfortable with that?
I think I would have felt more comfortable than I would have placing the chest tube, since it's not a procedure I've done all that often.
Okay.
And I was watching the monitor while he was doing the chest tube after I had checked for, breath sounds, but I wasn't given the role, and I didn't, for some reason, I really didn't feel like I'm not the most senior person on the team to take that over or make mention of it. So.
A couple of interesting points. Comfortable, and the team leader needs to be senior. I wonder if these are, you were going to say something.
No, I was just going to say that I did feel, that we knew that Seth was the team leader.
Mm-hmm.
And then because of the lack of resources, he decided to put in the chest tube because it needed to be done. And as I'm securing the airway, I kind of felt lost that we had lost the team leader,
Role.
and I wasn't sure where to go next or what to do next, so.
It would have been helpful if someone had maintained that role for you and for your team. Well, I think that you guys are touching on a lot of really important issues that are central to having a team leader and having a team role, and sometimes the tension between resources and being able to do things. Underlying it, what I'm hearing is there's a lot of assumptions because conversations maybe didn't happen or checking in when things didn't happen, and I think assumptions can really lead to sometimes errors or teams not working efficiently or effectively like they did. There was an assumption maybe that the resources were maximized, there was no other alternative needed to be done. There was an assumption that I don't feel that someone senior needs to be the team captain, that it can't just be someone who can step away and be able to maintain information flow. So I want us to think about this because I think it's a pretty commonplace. We all have assumptions when we're going about our day's business, but in a code situation, CRM gives us a really nice framework to have effective communication so that we can maybe compensate or address some of these assumptions and make our team work efficiently. Should we go try it again?
Sure. Yeah, thank you.